Now, let's listen to some patients who are receiving treatment, recovering, we understand, and the pain they are in and the advice they have for you.
I used to call myself the COVID police until the police caught me. What I'm going through, I was very serious about it. Everywhere I went, I was campaigning for it. But one day, I just lost guard myself, and then it happened. So let's just be careful. It doesn't matter who or where you are.
Grandchildren were for a party, and then after the party, they swam. So when they came to me, I think 2 days later, the big granddaughter was having some symptoms. By then, I didn't know the symptom. My eyes was like a running nose. After 4 days, I also started feeling a bit throat itching. But I didn't take it serious. I just went to do my concussion.
What I would say, it's not a comfortable disease. Yeah. People should take the warning seriously. People should observe the protocols. The disease is here. It is not a fake.
Surprisingly, I've been very careful as to how to manage my affairs on this COVID issue. But sometimes you are constrained. You find yourself in a lot of activities you cannot run away from. And so before you rise, Jack, you have it.
All right. Kwame Sapo Esiedu, thank you very much for joining us. He's pharmacist and fellow, Ghana Center for Democratic Development, CDD Ghana. Hello, Kwame. Yes, Kwame, okay, please unmute.
Can you hear me now?
Yes, I can hear you.
Okay, thanks, Samson, for having me.
Great. So in the studio, I have Dr. Dominic Ayine, who is MP for Boga East and member of the legal team of John Mahama. We will be joined via Zoom by Clara Berry Kasati, who is lawyer and lecturer, University of Ghana, School of Law. Clara is on. Thank you very much for joining us, Clara. Hello, Clara, unmute, please.
Yeah, thank you very much for having me, and good morning to your listeners and viewers and everyone across the country.
Great.
Beyond.
Here in the studio also is Dr. Bernard Okoboy, former Deputy Minister of Health and member, New Patriotic Party Communications Team. Thank you for making the time, sir. Gary Nimakoma for his member legal and constitutional committee of the New Patriotic Party. He will also be joining us later when we begin the discussion on the election petition. But Kwame, I start with you. And I saw you make a post where you gave a figure of 5,000 Ghana cedis as a standard that anybody could expect to spend in treating themselves, that is if they survived, in treating themselves for COVID-19 for the very short period that some have encountered. How is that?
Thanks, Samson, and good morning to all panelists. It's a bit worrying because managing COVID-19 in Ghana in public institutions is free. The government has borne the responsibility of paying for the management since the start of this pandemic. Unfortunately, in this second wave, most of the facilities have been full, and people are having to use a lot of private facilities. And these private facilities are paid for. I remember your colleague, Raymond Akwa, also saying that he had a similar bill when he was hospitalized and nearly lost his fight with this virus.
Right.
I have then had a number of my friends, close friends, and family as well, who unfortunately have also gotten this and have come up with bills as that. I am aware, and I have got receipts for a lady from Turkey as well, who unfortunately came to Ghana and caught the virus. And hear this, and I'll send you the documents later, Samson. The total bill over the 3 weeks that they stayed in hospital in Ghana is close to 43,000 Ghana cedis. And I have cross-checked this. So I made that post tongue-in-cheek, making people understand that though the government has borne these costs, the government is also actually incurring similar costs, albeit those going to government facilities are not having to pay for it. However, if you're unfortunate and you get unwell with this virus currently, and you are taken into some of the private facilities that have the ability to manage you, even if you pass away, and that is the thing, Samson, even if you pass away, you are going to be saddled with a huge bill in death. That is not a Russian roulette to pay. Especially when under these circumstances, you cannot even be sure of funeral, donations, because funerals are being constrained. So we are in a time where damn if you do and damn if you don't. And no one can compel these private facilities to charge less. Because if the government was to put out its figures for University of Ghana, for Kolebu, for Komfanoche, based on the tests that they have to do, you will be surprised at their numbers. And I'm quite sure Dr. Koboy would reluctantly put some of those numbers out. Their numbers are also hovering around same, but just that it's being borne by the state, so no one knows.
Okay.
And the bigger question we have to ask ourselves is, for how long can we allow this to happen?
Right. What danger do we face? And guys, I appreciate, particularly from the government people, when they say spread calm, don't spread fear. It's not about spreading fear, it's about talking about the facts. What danger do we face as a nation when our ICUs are full, and as you just said, people now have to resort to private, institutions, medical facilities, at such a time, we are not doing what we were doing earlier, where we went out to test and isolate and treat, but wait for people to fall ill and come to the hospital. And as we are being told, people get to the hospital critically ill. And that is beginning to give a meaning to why we are hearing of the deaths at a faster rate.
Right. I would have to be blunt. And I have to, because we are not in a time where holding back is going to serve any purpose. This week, I've known 12 people, not just acquaintances, human beings with families who I know personally who have succumbed. A friend of mine, Kofi Amekuji, made a post yesterday. We were debating and he said it's getting to the point where if this was politics, we would say one death, one family. And that is how serious it has become. So this is the thing. When we changed our testing strategy, there was reason for it, because at that time our positivity had gone down, and the WHO says that when your positivity is below 5%, then it means you are testing quite well. For a long time, our positivity had been over 10-15%. So when it dropped, and considering that the PCR testing is expensive, the government, in its wisdom, based on the advice it received from the health technocrats, decided to change our testing strategy, where we only tested symptomatic people who fitted the case definition and came to our hospitals. There was a saving there. But what it also meant, based on the disease we're dealing with, COVID, where in the trajectory, you are aware that about 85% of all cases are asymptomatic or mildly symptomatic. It meant, therefore, that our testing was only capturing the 15% who were getting symptoms and coming into hospital. And for a long time, we had been doing that. Therefore, the 85% were in the community, and at best, even amongst the 15%, as a pharmacist, I've spoken to colleagues in Ghana who tell me that a lot of them would come to the pharmacy with all these symptoms, and you tell them to go and test, and they were saying that, well, I can't be bothered to go to hospital. I know what they are going to give me, try and give me it. Or you signpost them and say, go to this testing facility, and they say, I don't have 300 to 1,000 cedis to be paying to get tested. So these people were in the community. And with a disease that has a reproductive number of 3 unchecked, which means that on average, every infected person would infect 3 people unchecked. And knowing that we were not wearing our face masks, we had avoided social distancing, we were aggregating and holding parties and rallies and all the things that actually cause the virus to move, the exponential growth was going on in the community. What does that mean? The unfortunate thing about the public health pandemic domino effect is that the more people get infected, the bigger the 15% become in true numbers. That is, those who would become symptomatic and have to go into hospital. The bigger the 15% becomes, the more people get hospitalized. The more people get hospitalized, the more our facilities get filled up. The more our facilities get filled up, the more people are going to get critically and severely ill. And unfortunately, the more are going to go into ICU, and unfortunately, the Grim Reaper, the more are going to die. This is the reality we are saddled with now. So what we are seeing is the lag of the domino effect from the time the infections happened to the time where, unfortunately, people are succumbing. Then you've got the actual extra existential threat, which is a lot of the facilities that government built were well schooled to deal with the pandemic. So you realize that at the beginning, our case mortality ratios were relatively low. As they get filled up, people are using peripheral health facilities who, though the health professionals may be willed and skilled, the accoutrements to actually manage the disease as it gets complicated are not available. And therefore, quality of care also drops. That also leads to mortalities. So we are dealing with a barrage that is contributing to people getting very sick and our mortalities increasing. And the downside being that a lot of people are also living with what's called long COVID or post-COVID, because they are getting symptoms that, even though they are getting discharged, are lasting longer than they normally would if they had gone into hospital early. So these are the realities of the time.
All right. Thank you, Kwame. Dr. Okoboy, I remember that at the start, when we started preaching, because everywhere else in the world, they were thinking and planning how to assemble, what do you call them? Ventilators. At the time, as a country, we could not even boast of 100 of those. At this time, when the ICUs are full, how are we doing, really?
Yeah. Thank you, Samson. Good morning to all your viewers. Let me also use this opportunity. I'm in black because today we'll be attending the funeral of Elder James Kojo-Osei. That's the brother of the Chief of Staff. And so my condolences to her. And the brother's daughter, that's the niece, is a doctor, a physician I work with at the Lekma Hospital. He's the med soup. So my condolences to her as well.
Okay.
Yeah. Let me say that it's true. I mean, I followed what my brother from CDD said, and most are on point. The last time when the president spoke, he actually mentioned that, yeah, we are not in good times. Our cases had gone beyond the 2,000 threshold. And I tell people that there is bad news and there is good news in there. The good news is that the mode of transmission of the virus hasn't changed. What it means that what we've been taught from day one, if we continue to go by that, you reduce your risk of getting it. Although we've had variants, it basically moves the same way through droplets, through the air, in enclosed spaces and all that. I want to be frank with some of these things. You see, the science tells us that if you have large numbers, the risk is high. Yes, we had rallies and other political activity, but normally the incubation period between the time of getting the virus and falling ill, we're looking at 2 to let's say 4 weeks. So yes, gathering, there is a possibility or risk with it. But we realized that we weren't getting as many cases a month or two when the campaign peaked, like we had in the festivities. So some of the GHS technical people, we did some small history and research into the background of the cases. What we realized is that most of the people that came down with the illness were people who had middle, upper class, had gone for parties, programs. The numbers were not that huge, but they were in enclosed environments. And so we realized that there's a serious risk also that comes with having programs in an enclosed setting. And the reason is simple. It's not just the enclosed setting, but the length of the contact. Once you are in an enclosed setting, it comes to eating, your mask must go off. So basically, if you are only 5 in a room, but it's enclosed, within an hour, the particles in the air is coming from all of you. And if one person has it, all can come down with the illness. So really, we've also done some work, locally, to understand why the peak happened. And as a scientist, I'm careful the way I speak. I've heard people who talk about political activity. The risk is not zero. Yes, you can speak to some risk, but in terms of the history of the cases that we've had, the numbers in our hospitals now, a lot of them found themselves in these, these enclosed gatherings where even if you are few, you are sharing the same air. I think I also made a point to a friend that once the global risk of COVID goes up, as in the second wave in Europe and America, we are not totally isolated in terms of risk because the world is a global village. We have a testing regime at the airport. It can peak, if there are 1,000 positives, it can peak 999. There is no guarantee. In fact, even with a strict testing regime, globally, the standard is that 1 or 2 can move out. Before coming here, I read, I don't know what I've seen, the Danish release. There is a release from, I think, Netherlands, rather, about people from Ghana now having to do an antigen test, even if you have a PCR test. And the reason is that you can have a PCR test, but you can, maybe with it, just before coming, it's possible that you can have the virus. But I refer to the Netherlands release for one reason. Their protocol doesn't allow kids 1 to 3 years to be tested. I think 1 to 4. And the reason is that because it's a traumatic experience, most places they exempt kids. But here we are, the science also has taught us that a child can have it and still be okay. But when it enters your population, it can give it to elderly folks. And like the woman who you interviewed spoke about the children. So the point I'm making is that globally, we're in a pandemic. A risk elsewhere can be a risk here. So let me speak to what government is trying to do to address the situation. It's true, you can't really blame government that much for reducing the intensity of the contact tracing because our cases went down significantly. Like my colleague hinted, it got to a point you had about 300 active cases. Now, if you have 300 people and you are going after their contacts, their number will not be the same as when you had, let's say, 900 cases. And our isolation centers, the one at Kasua became virtually empty. Most of our treatment facilities too were not having cases. So they dissolved the gangs, the medical groups we had. We had to form some COVID teams. We pulled doctors from Kolebu, intensivists, nurses from other places. When it got to the time when they weren't having much cases, they dissolved them. What we've done now is to regroup, to bring them back. University of Ghana Medical Center, Kolebu and Ganyist were the classical treatment centers. As I speak, we have created another treatment center at the Ridge Hospital, has about 16 beds. The Ghana Infectious Disease Center, which was built with private collaboration, had some infrastructural challenges, but as we speak, it's been operational for the past, I think, 1 or 2 weeks. Has 100 beds, 5 ICU facilities, and HDU. All the beds are HDU, meaning if you need oxygen, all the 100 beds can give you critical care for severe cases. So something like you asked, our ventilator count has gone up significantly. I'm sure it's more than 20, 30 times what we had in the beginning of the pandemic. So we've increased our technical capacity. But I want to be very cautious and give a warning here. I don't speak to this beefed up bed space to encourage you to more or less act funny and be reckless. The good news I continue to say is that in terms of transmission, the virus hasn't changed its way. And I'm happy people are watching NewsFile. Some say this is the most fertile environment for classical transmission of the virus. The R03 talked about the transmission rate. It is when you have a place like this, luckily because of some code, I asked that the air condition go. But when you have the air condition on, this place is enclosed. If we take off our mask, within 1 hour, 2 hours, if you use the electron microscope, you see the place filled up with our particles, and we'll be breathing our air. So although it's not a crowd, and you can even have a 6 whatever feet distance, still people can get infected. So really, I try to tell people, avoid enclosed spaces. Keep your mask on. If we are 100 here, we are close to each other. We stay here for 10 hours, something, but my mask is on. It will be difficult to give me the virus. So the point I make is that if you can't avoid a particular setting, just make sure that your mask doesn't go off. The temptation comes to feeding. The only time when people, losing their guard, is when you have to drink or eat, because you can't drink through the mask. So I tell folks that if you go to a place and it's enclosed, do take away. Don't drop the mask. 5 minutes of dropping the mask, you inhale the particles of another person, and that's it. And the virus doesn't pass through your mouth to infect you. The root is the nostril. So once it's about inhaling someone's particles, it is very it's facilitated. So that is what I have to say about. And then
because of what you just spoke about being in enclosed places, is there danger in having children being in school from as early as 7, 8 until about 4 p.m.?
Someone asked me, Doc, how come the situation is very, very bad in Europe and America? We are in difficult times though, but when you compare it to the global picture, even to the African picture, we are not, ours is not as, as hopeless as it's in the States and elsewhere. And I gave 2 reasons. The experts in the US, like Fauci, said they were going to experience a second wave in the winter. The reason was for 2 reasons. One, the virus theoretically, I say theoretically because we are still doing a lot of studies, appears to have preference for cold. And that's why the day that we had 500 people being infected in Tema, I mentioned to someone that this must be an environment that looks like not America or the North Pole. And I wasn't surprised when they said it was a fish processing factory, because it's an enclosed environment with temperatures below 0. So then it can move very fast. So temperature is one. The second one is the structure of the community. This is the only time when, if you have a community that is not developed or structured, you appear to be at lower risk. In Ghana, the kids that go to school, 98%, their classrooms are not air-conditioned and closed. Its air comes in and goes out. Right. Immediately you are in an environment where it is open ventilation, the risk drops significantly. Because the particles can accumulate. It is diffused. But in Europe, school for kids, even in winter or summer, most of the time is enclosed. You enter the train, it's enclosed. Gym is enclosed. Supermarkets are enclosed. But when you come to Africa, our setting is open. So for kids, I think one key reason why the president allowed the kids to go back to school, one is that most of our classrooms are the open type. The second one, is that we have an idea as to what caused the spike, this recent one. The first one has to do with the social activities that we engaged in. And the second one has to do with a mixing of people who came into our population, as in travel. Now, if that risk had still persisted, if we were going to enter another festive season, there is no way I would have advised that we open the schools. But that risk factor is going to go down going forward. Okay. And then secondly, kids are known to be quite robust, but they can transmit. And let me add that we know that there is a risk of the virus in the global population, including Ghana. Right. And that is why we put in place protocols. Right. Nobody can ensure 0 risk in a pandemic. What you do is called risk reduction.
I'll bring in my lawyers
Yes.
shortly to look at the enforcement regime, but I need you in 1 minute. Tell us, how ready are we? What is the planning, execution of the plan like for vaccination?
All right, so what we are doing now is that there are two routes. There's a global platform that has been created by WHO called the COVAX facility. COVAX means that it's coronavirus access platform. And they are allowing low to middle income countries who might not be rich as the West to access this platform. You can get 20% of your population needs. So 20% of our population would be given to us, more or less through a special arrangement, like a grant. But the rest of the 80%, you have to pay yourself. Now, so we have applied to that platform. They would start disbursing first quarter to countries that have applied. But we are also exploring the bilateral route. So top government officials, I know my boss, my former boss, the Minister for Health, is talking to some of the manufacturing companies. Ghana is looking at buying some directly also. And then as we speak, there's a technical committee to look at the criteria for the rollout, who gets first. What is absolute is that health workers are very high on the list. And then secondly, people have mentioned the security services because of their mixing with populations outside the country on operations. I also know that elderly people with who can prove underlying conditions like heart disease, kidney and all that, and people with a high turnover rate for meeting others like transport operators, people who meet a lot of people in a day, teachers who have to go and mingle with kids and all that. So we are looking at it very seriously.
Okay. Kwame, what would you say about our preparedness in executing a plan for vaccination to conclude? And what would you want to see change so that we don't get to the point where we know we don't have money, we just can't? I mean, if we were hit like other countries in Europe are being hit, we can almost be assured that we'll be damned and doomed.
Thanks, Samson. I think Bernard has addressed the vaccine issue quite well, but we need to understand the game of the vaccine issue. And what do I mean by the game of the vaccine issue? The game of the vaccine issue is the fact that there's what we call the herd immunity threshold. That is the number of people in a population you have to vaccinate for you to virtually constrain the disease and prevent it from spreading significantly and for people to get ill. That threshold is calculated by dividing the reproductive number by 1 plus the reproductive number. So for COVID, the herd immunity threshold is 75% because it's 3/4, which means for Ghana, a population of 31.3 million, you've got to immunize 22.75 million people to hit the herd immunity threshold. That's the first thing. COVAX is giving us up to 20%. Bernard said 20%, but if you read the the memorandum, it says up to 20%. I am also aware that Serum Institute are having challenges with the Indian government because the Indian government is saying that unless half their population has been supplied, they are going to constrain supplies from Serum Institute to COVAX, and therefore the distribution is having some challenges. But hopefully, I'm quite sure that that will be addressed with the government of India. But that said, the 20% is 6 million Ghanaians. And we have to inoculate 22.75. So we've got 16.75 million vaccines that we have to source from elsewhere. That is a huge challenge for government. I'm glad that they have put committees in place to do this. But the speed at which the bilateral routes are moving from countries, just before I came on this program, I put up a post where Morocco has signed a bilateral with Sinopharm China to, get stocks of Corovax, which is the Chinese vaccination, the vaccine. Ghana can go down that route. There's also the Sputnik that people are edgy about the Russian vaccine, but the data I've seen on that vaccine so far is no different from any of the data sets we have seen for all the other vaccines. So we can look at that as well. But the biggest thing is for us to learn as a country that we cannot continue pussyfooting when it comes to vaccine research, and learn to collaborate during the development stages and not wait to get in and seek bilateral agreements when the food is cooked and the vaccines are licensed. That puts you at significant disadvantage. All the countries that have done the bilateral so far participated in the vaccine development of the vaccines for which they have bilateral agreements. That put their foot through the door. Ghana hasn't done that, and we have to learn. Finally, what do I want to see change? I want us to take our personal health responsibilities seriously, to start with. The wearing of the mask is no longer a fashion statement or luxury. It is a life and death necessity, and we all need to do that. Then the government has to also realize that no country has citizens who by default are law-abiding. Humans by nature are lawless and reckless. In societies where lawfulness persists, it's because modalities are put in place for lawfulness to persist, and people are willing to enforce the modalities that ensure lawfulness. We need to do that as well. And I have seen footage of the police arresting people yesterday who are not wearing face masks. I commend them highly, but I'd also want to caution them that arresting them and banding them together into vans and all that is another super spreader event. I know we are resource constrained, but we would have to think seriously about how we head these people together when they are arrested in holding areas before either they are processed for court, they are put in cells or other things, because that could come and bite us as well. But the police would only arrest you if you don't wear a mask.
Right.
So if we as citizens are sensible as well, we should save the police the trouble of getting these super spreader events started because they have to arrest us en masse in shopping centers and in trotro stations by just wearing our mask. We need to bear in mind that the variants that have come in currently are 50 to 70% more contagious than the one that came from Wuhan. That brings a huge challenge to everybody. So, like you heard the lady say, you cannot be the virus police. You cannot take chances, because this time the virus has gotten smarter. Its dyslexia has made it not copy its gene sequence properly, and it has made it more contagious. But the more dangerous thing is, it's doing exactly what all human beings do. It is doing this to survive.
All right.
So it is outfoxing all the older viruses, and very soon we would have only the new variants, and that would be a game changer. So we need to be disciplined. Thank you.
Thank you very much. Kwame Sapong-Esiedu is a pharmacist and fellow Ghana Center for Democratic Development, CDD. He's been very, very instrumental and availed himself to this country from the UK where he lives since coronavirus broke. Thank you so very much. Now, let me bring in Clara and Dominic. Now, Clara, Dr. Dominic Ayine are the ones who sat in Parliament and passed the restriction of Enoko Boy, correct, yeah, and passed the Imposition of Restrictions Act. Now, in that law, the president has been empowered, and he issued the EIs requiring and mandating everybody to wear a mask once you are in a public place. Once you get out of your home, you wear a mask, a face shield, or a face covering. And you are supposed to cover your nose and your mouth completely. So not wearing the mask correctly is also an offense. And if you are found not to be doing it or doing it rightly, the minimum fine is 12,000 Ghana cedis. The minimum sentence is 4 years. You could get up to 60,000 Ghana cedis, and you could also get up to 10 years in jail. There has been a crusade. The Ghana Bar Association joined and asked that there should be a relook. As we said, that hasn't happened. There is a suggestion that the police clearly couldn't enforce the law, and that's why they just left everything until the president issued the orders asking them to arrest. They step out of their premises, few meters, and we are told that one police station has arrested some 90 plus people. What do you think? What can be done?
I think we all know, if we are being honest, that if the police is going to enforce that law, they will have no place to hold up the people that would have been convicted. So yes, there's an issue, but it's not realistic in terms of enforcement, because let's face it, even within Accra, if they just step out of their house and take a few meters, go to the markets, I don't think there will be any spaces left in the prisons to take more people. So there's an issue with the law, but it also comes, to some extent, I want to understand when it started. Probably they themselves were panicking, and then they were looking at what they thought could deter a lot of people. But then they also left out that it was not realistic, even from the very beginning. And if we know the way our society is, it wasn't realistic. And in terms of passing laws, I always have a problem when you pass a law that you know is not realistic to enforce. Because when that happens, my concern usually is what that then means, which means that it will probably end up being used as a victimization or persecution tool. If you know that, okay, this law is not realistic to enforce, virtually nobody is obeying it, but then you lie in wait for your enemy that you have been timing for some time, so that as soon as they go foul, you can then use such a law. So I have a problem with laws that are this unreasonable, if you ask me. 10 years in jail, a lot of the Ghanaian population is not going to be able to pay a fine, for the designated fine, for example. And when it comes to wearing of mask is very, very important. Part of the discussion we should also have is to be realistic and know the kinds of populations that we have. If we look at our economy and if we look at incomes of households, let's be honest, how many households can afford a mask a day? So do they know the kinds of masks? There has been a lot of education. We need to start asking questions as to how effective the education has been. It's not enough to have the education. If you give information, but you are not able to give it in such a way that the people understand and comply, your education has not been effective. So we probably need to look at how effective education has been, and also probably discuss. Now we would need the health professionals in terms of the mask.
Just hold on a second. For those of you watching the television, those people you are seeing are the first set of people that were, arrested. Immediately, the Accra Regional Police stepped out of their office. So you can see them, and I'm watching them even, use their hands over their faces, bare hands. What may they have touched, and see how they are crammed together over there. They said we were going to process them. I do not know the update yet, how they have managed to process them and which courts they have taken them to. Yes, okay, Clara, go on.
Yes, and even from the video, we can see there's no social distancing either.
Zero.
Which is another, yes, which, like Kwame said, ends up being a super spreader itself. Just by bringing them together in an attempt to enforce the law. So I think we need to be a lot more creative. And then we also really need to discuss about the issue of mask. Are there some masks that we could probably guide people as to which mask they can reuse and how to keep and maintain masks? Because the truth is, if we are being honest, not everybody is going to be able to afford a mask a day. The surgical mask, for example, that I understand can only be used once. How many families that every day for how many days a month and in 2 months that every day they can afford a mask when they are leaving their homes? So probably
so Clara, I've been telling the story of this person that I interviewed on the street. around the Abosokai area. And when I asked him why he wasn't in a mask and that he was exposing himself and everything, he told me the whole day what he has made was about 5 Ghana cedis. And the mask, he said, at the time cost that much. So did I expect him to use that money to buy a mask? So my response to him was that the law says face mask, face shield, or face covering. A face covering simply means he is catered for. If he can't buy one, he could find a piece of cloth, handkerchief, manage for as long as he can get it to cover his nose and mouth completely, he's safe. So the law took care of other people, right?
But how has that education gone? For a lot of the people, all they know is that I have to wear a mask. So have we done sufficient education for people to realize that if I don't have a mask, I can use any other piece of cloth? And have we taught them how to care for the piece of cloth? Because a lot of people really, all they really know is a mask, and they think they can't afford one. So it comes back to the effectiveness of our education. We always say that ignorance of the law is no excuse. But the reality of the matter, too, is that in a situation like a pandemic or like something like COVID-19, nobody benefits when we go singing ignorance of the law is no excuse. It is in our interest to educate people what options they have. Because like the guy you interviewed, it's realistic. He cannot use his 5 cedis to buy a mask when that's all he's earned in a day. He needs to eat fast to survive. So I think we need to revisit, and where probably we can support certain sectors of our population, we at least provide them with quite a number of masks, reusable masks, for example, that we could use, and do that alongside enforcement.
All right.
So this is when we do education, enforcement at the same time. And certainly let's take another look at the sanctions of the law so that we can make it more reasonable. Right. And we cannot, so that enforcement doesn't end up creating a bigger problem.
All right. Now,
than it was intended to solve.
Okay, so you made the law, Dr. Ayina, you made the law. Did you think about this, that this was what we're going to encounter? And since an important body like the Ghana Bar Association stepped in to say, let's have a relook, how have we taken this as an urgent matter so that we don't get to the point where I have, for example, illustrated that the police would then need buses to go out because within minutes they will have to arrest many people. Then they will need, stadia of police stations to transport them to process them. It will replicate itself for a court. Which courts are they going to take them? Which prisons are they going to put them? How urgent is a review? And look at that against the example that I have also been referring to in the Volta region. What they did in the whole municipality was that they used their assembly to pass a bylaw. The bylaw was so humane. It said, if you are found not wearing a mask, you will be stopped. There's a spot fine, some 100 cedis, 20 cedis, and then you'll be handed masks.
That's very interesting. I wonder how that fits into the Imposition of Restrictions Act as well as the executive instruments that the... It's a local variant. Right, it's a local variant, yeah. But as you rightly pointed out, it's a very humane way of dealing with the matter, and a more practical way, because if you pay 20 cedis and then you are handed a mask, at least you can use that to protect yourself as you roam around, in public. But something, let me say this, you see, when the president brought the Imposition of Restrictions Bill to Parliament, I think there were 2 underlying assumptions, all right, that in this public, pandemic, health crisis, there cannot be order without law. Okay, and I think that's the point that was underscored by, Mr. Asedu, Kwame Sapong, when he talked about, briefly on the enforcement. So the assumption was that there cannot be order without law. So let's have a legal framework that will regulate how we deal with this pandemic, because it's a public health crisis, all right? I think the second, underlying assumption is that law, as a German legal philosopher once put it, is communicative action. So let's communicate to the population that we are taking this matter so seriously that if you violate the law, okay, you are going to pay dearly for it. Because as Clara, pointed out, very eloquently, if you have a regime that says a minimum payment of 1,000 penalty units, okay, and one penalty unit is 12 cedis. So you're looking at 12,000 Ghana cedis. How many people in this population can pay 12,000 Ghana cedis? And then a maximum of 60,000, Ghana cedis. So it means that ultimately, for a greater majority of our population, you are looking at prison sentences, okay? And you yourself has pointed out that we will then need, stadia, literally, of prisons to be able to contain everyone. When Clara was talking, I was just reliving the experience that I had when I went to home campaigning. And even recently, I was home last week, and I attended funerals. And people insisted on shaking hands with me, having the bodily contact and so on. And they were not wearing masks, okay? When I insist that, you need to wear a mask, they would ask me, have you supplied us some? Okay? Now, a mask now costs in Accra 2 Ghana cedis. I can imagine in Zorungu the number of people who can spend 2 Ghana cedis a day in order to be able to, afford a mask. And you cannot, from a public health, perspective, Dr. Okoboy is here. This mask cannot be used for more than 1 day.
Yes.
So it means that, for a week, if the person has to go out, they need not less than 14 cedis to be able to, roam.
Of course, now you can get it for 1 cedi, but we had a report somewhere from Tamale where somebody was selling for 6 cedis. You don't know how somebody even thinks that they can profiteer from this.
Exactly. So you asked a very poignant question, which is it time for a review? I think it is time for a review, okay? Because, the life of the law is not just logic, it's also experience.
That's right.
So we have experienced the implementation of the Imposition of Restrictions Act and the pursuant executive instruments that the president has passed, all right, up to this point. What you showed, the clips that you showed, and your own interview on the street shows that this regime will not work for us. So we need a more humane regime. Maybe the whole municipality example that you gave is something that we need to take up very, very seriously. So we probably need to look at the sanctions regime very critically.
I've had very senior physicians speak to me from outside of this country. Once they get to know these are the issues you are discussing, right. And I get this very often.
Yeah.
But once they know you are talking about coronavirus, I get unsolicited, very good views from all over. Right. And I hear consistently they empathizing with the poor in Ghana and say, why can't the state commit to providing free masks? Is that sustainable?
Well, I will leave that question to my good friend, Dr. Okoboy, who has worked at the Ministry of Health. But I think it can be sustained, right, if we commit resources through the assemblies, for provision of masks, probably on a monthly basis. Okay, if we make quarterly allocations towards the procurement of masks for households.
Reusable ones. Like we did for the students.
Right. I think is doable. We are not too poor a country as not to be able to, afford to do this. I think we can do it. Yeah.
How urgent do you find the need to review this?
I think we should. I think we should be looking at it immediately. I think we should be looking at it immediately. And given what I have seen, I will probably begin discussions with my friends on the opposite side about whether or not, if the president is not bringing a review, of the law, we can start something by way of a private members bill.
In fact, surprisingly, whilst you fixed the minimum at 12,000, I think the first case, which involved 2 or 3 pastors, when they were taken to court and they pleaded guilty, they were handed not the minimum, a little above the minimum. Wow. And they couldn't pay. So I think we understand it was a Pentecost church or one other that went to their rescue and paid for them.
I think with the pastors, maybe it's good to remind our viewers, it was not necessarily their non-wearing of the mask. It was they breaking the restriction to have their service at a time when services
there was a lockdown.
Yes. Yeah. So maybe the judge went for that to send a strong signal that other states will mean business. But the point is that, I agree that you want, as much as possible, people to be able to afford the sanctions when they have to apply them. But I think the most motivating factor was the deterrence. I think if you look at this particular regime, it was hoped that looking at the nature of the sanctions, it would deter people. Right. But from the experience, it appears that it didn't achieve that.
All right.
So if anybody calls for review, it's something that is in good taste. Okay. Let me quickly say that for public health purposes, you don't necessarily have to be wearing a surgical mask to reduce your risk. A cloth mask, when washed, if you have 3 of them, and you even wash them, at the end of the day, you wash, iron. I mean, you can use for some time. Maybe you can, once you wash daily and iron, rewash, you can use for about a week or 2. So you want to also to show people how to try to comply within their meager resources. I'm happy that my colleague from CDD reminded viewers that it cost someone 43,000 to go through COVID.
Meanwhile, for instance, a friend of mine died 2 weeks ago. The bill was 23,000.
Yes. Meanwhile, something from day one, I've been telling people, sometimes people create the impression that, the monies that we allocate to COVID, and what are we using for? It has been government policy since day one. Once you are diagnosed of COVID, and you are in a government facility, from the OPD to the ICU, all is borne by the state. Even sometimes,
I don't want us to focus on talking about failures.
Okay, all right.
But do you think you really did a good job? If, as we speak, there are people who say coronavirus does not exist, and our reporters went to the markets, and there are people who say there's no need to wear it, and in fact, some of them were pointing to the political campaigning period. Do you think you have done the needed education for this to happen?
I'm happy that, again, my brother from CDD reminded you that human beings by nature are what?
Lawless and reckless.
Look, there is a difference between, in public health, they teach you what they refer to as the health belief model, which is meant to help someone who has received education to move from the state of behavior to one that will seek better health. It's a very difficult task. There are all kinds of models you are taught to achieve it. What it means is that it's not enough to educate someone and say there is a virus called COVID. When it infects you, you can go down and all that. Until the fellow has a personal experience, they might refuse to do the things you've asked them to do. And when you watch elsewhere, in fact, in Germany, there was a time people went out there to confront the police.
Yes.
That they couldn't bear it any longer. They've been indoors for too long, when still the risk was out there. So the point I'm making is that government did education, but this transmogrification from behaving in a particular way to another way is another task.
If you did the education and the compliance level is not satisfactory, to the extent that police will move out within minutes and they can get a bus load of people. What's the evidence of how effective your education is?
There are 2 things that helps to drive compliance. 2 things. Unfortunately, when the prevalence is high and widespread, it comes more home. People feel it. If, let's say, in every community, you've had 3 or 4 who have been seriously ill with it.
You don't have this opportunity in this situation because it kills.
I just want, it's education, public education. I'm just telling you that globally, when a disease has prevalence that goes across, based on the relevance, nearness, people comply.
Right.
But if you are dealing with a disease, if you you plot the path of cases in Ghana, Ashanti, Greater Accra, Western, it's places that receive travelers from Accra, where a lot of people are going. Unfortunately, because of this, it's an imported disease. Many places where you don't have a lot of travelers going to have 0 or no cases, like your place that you went to. So if you tell them that, look, wear the mask, because they've not had anyone in their hospitals, it looks like it's a theory to them. And that's not to support what is happening.
All right.
But it's to tell you the huge challenge you have on your hand when you are dealing with a disease that appears to be far. The way to address it is what the police is doing. You know, for some time, people thought that, look, these laws are just there to, you know, for fun. But once you hear that your colleague has been...
Well, you speak to the police and they will tell you how frustrated they are and how almost how impractical they feel.
But you also saw,
they find themselves.
if I may come in, you also saw the clip.
Yeah.
People were in front of the police with their mask not properly on. Some even mask.
Right.
You know,
okay, so just we need to take a break here, but I need to get you just in some seconds. Is there a nasal drop approved for use anywhere in this country about COVID?
Well, I've seen people have called me about that one.
Somebody is asking that question.
Yes, yes. Yeah. You know, one thing, if a drug is approved in our list of drugs in the country, maybe it's used for certain purposes. But if someone suggests that it can also deactivate or reduce the entry of virus and you use it, at that level you are using it for the purpose. But nationally as a country, we've not come to approve it as a way of preventing the virus. But I know some people are.
Okay. Yeah. Angela says to tell all of you that the law must be reviewed yesterday. The police themselves will be infected at this rate, and then who will do the arrests? I have several of such comments coming in. We'll take a break here. When we return, we try to understand how on earth, on Ghanaian soil, where military have been withdrawn from the Galamsey operations, you have as many as 30 armed soldiers protecting a private entity said not to have a license to mine, pillaging the Manso Forest Reserve. We'll be right back.